On this episode of the Ask Mike Reinold Show, we talk about how we rehab our non-athletes after ACL reconstruction and if there is any difference between what we do with our athletes. And we also talk about,
rehabbing your own injuries.
Rehabbing your own injuries. The Ask Mike Reinold Show. Helping people feel better, move better, and perform better. Welcome back, everybody, to the Ask Mike Reinold Show. We're up at
Boston. Champion PT and Performance in Boston, Massachusetts. Ring review us on Spotify.
I don't even know what I'm saying. I just black out and go through the intros and stuff. Just keep asking us awesome questions from the website. Go to mikereinold.com and ask us stuff.
Boston students questions next.
Yeah, that's amazing. Students, I want you guys to introduce the physical therapists. I want to see it.
All right. Okay, so we have Mike Scudo, MikeScudo.com, and Mike is originally from New Jersey. We have Dave Tilley, Shift Movement Science. May, take it away.
All right.
Abort.
We got Dan Pope over here, FitnessPainFree.com, and Lenny Mack.
PT.
What's my website?
At LenMac on Twitter.
Do I have a website? Okay, good.
Not a subscriber.
She did not learn about low back pain this morning.
That's pretty funny. So awesome, very good. Len, your turn to get back at them.
All right, I want to introduce the students, but no, they can introduce themselves.
Wow, fooling us again.
Tell us something cool about
Fun
yourself.
fact.
Fun fact.
No, what's your name? Where do you go to school? What's your website? Kidding. And one fun fact.
One fun fact. All right, Cara May Sheft. I go by May. Belmont University in Nashville, Tennessee.
Check.
Fun fact. I ride horses. Is that a fun fact?
Yeah, that's
Very
fun.
fun.
Nick, what's yours?
I read those.
Nick Giacopello, Toro College in Long Island, New
Bull.
York.
Horns up,
Go
Toro
Bulls.
College.
And my favorite ice cream is strawberry.
Oh,
Really?
whoa.
Like on its own, or?
Fisher Mark of a psychopath.
I guess.
Whoa.
I guess on its own. Yeah.
Sometimes I go one scoop strawberry, one scoop chocolate. I think
People
it's
do
Is that called Napoleon when it's all
You can't
fruits?
mix chocolate and strawberry.
Neapolitan.
Nobody wants vanilla in there. Stop making vanilla in that.
Strawberry.
No, that's a bad
I do.
Vanilla strawberry is good. Chocolate strawberry.
I like it. All right, before we get into our questions, Mike, quick fun fact from Mike Scudo.
Fun fact: I was in a movie when I was about 12 years old, and it was filmed in my house. The full version's on YouTube. It was a Sundance.
What's going on, Warren?
Sundance Film Festival award-winning movie. Check it out. It's called What Alice Found. Written and directed by Aideen Bell.
Wait, what did she find?
What did Alice find in your house?
Check it out.
Like Alice from the Brady Bunch, like the maid?
Check it out. Check out the movie. Written by Aideen Bell.
I thought this was gonna be like fun, like crazy facts, not
I wanted
like.
a Snapple fact, not a...
Is this like a non-humble boast?
That's my icebreaker.
Weird flex.
All time.
Are you in the Actors Guild?
I have an IMDb.
IMDb.
IMDb. I have an IMDb.
Oh my god, Kindred's off.
Is that a
We got those-
disease?
Google this. Google this for me. Just wave at me when you have our answer.
Yes,
We're gonna go there.
yes, two marked. It was that one, then Avengers.
What do we got, May? What do we got for questions? Let's get to the questions.
Put on Apple TV.
All right, Nick from Chicago. Hi, team champion. I've had a couple non-athlete patients on my schedule who tore their ACL during normal activities, such as running to catch a bus. How do you guys handle ACL rehab for someone who isn't very athletic and didn't really exercise prior to their injury?
That sucks.
Yeah.
Imagine tearing your ACL like running for a bus.
Just going for it.
I know, like I don't think we have the full story.
Yeah.
That sucks.
You missed the bus, too, probably.
Len, how do you? Yeah, there's no way they made the bus, right?
Ruined that day.
Len, what do you do different in your post-op rehab for ACLs with your patients that are not trying to get back to a sport?
Right. I mean, it's getting them back to their function. So if they're not trying to get back to football or basketball or some kind of jumping sport, then they're probably not going to need to do much of that end stage plyometric type stuff. It depends on the person. It depends on their body type, their goals. She needs to run to catch a bus every once in a while. It's a she. I'm assuming it's a she. So
Why are you assuming it's a
Are you going to make her return to bus? Are you going to make her a return to bus program?
return to running to the bus program.
Oh
But
my
I
God.
think
How do you simulate a bus taking off in the clinic? You're like, wait! Sorry.
But I still think nothing changes for probably the first 12, 16 weeks, right? You're still getting the range of motion back, you're still getting the swelling out, you're still getting their baseline strength back, whatever that is. And then what's their ultimate goal is, I mean, up and down steps, walking is a plyometric type movement. Every time you take a step, you're receiving the weight on that knee and having to be able to control it. So there are still concepts that you need to utilize for people that are non-athletes. But maybe this is the wake-up call for this person who tore her ACL or his ACL running to a bus, that they need to be a little bit better shape to be able to handle the stresses of regular life. You know, maybe this is their moment to shine.
So you would shame them?
I would shame them. I would, yeah. And, no, I mean, again, it's getting all that baseline stuff back, and then figuring out, you know, how are we going to get their quads to get back to 100% to what they were before the injury.
So get them an Uber gift card.
Exactly. Get them a chauffeur.
All right. Would anyone? So Lenza was kind of similar. Would anyone go slower? Anyone go slower with range of motion?
I would definitely go slower with exercise because I've never done it before.
That's a good point.
Assuming that.
They need to learn how to just squat.
Let me say advanced. You would go slower with advanced strength. I don't want to put words in your mouth. You would still do. There's no reason to go slower with rehab. Strengthening type stuff.
Much more teaching of movement.
Yeah, what about range of motion?
I have a feeling if this is a non-athletic person, the doctor would probably talk them into an allograft, so a cadaver, or some kind of soft tissue graft like a hamstring. And we know that healing time takes longer than an autograft patella tendon that's bone and bone. So you're going to have to respect the healing times of the graft so you don't stretch it out. So you would go slower, maybe with some open chain stuff or even some weight bearing stuff, because you don't want to swell the knee up and maybe even cause extra stress on the ligaments. So yeah, you would go maybe a little bit slower knowing what the graft is, but I think just overall you're still going to get their motion back. You're not going to kill them and push them in a ton of pain. I never do that anyway with my athletes. So I think not much changes besides knowing the graft and the ultimate goals.
Yeah.
You know?
I guess switching a little bit, but I think one of these things is really challenging with this patient population is that you have to set these expectations for exercise, you know? We tend to work with a lot of athletes, and athletes getting back is actually phenomenal because they want to exercise, they want to get back. So we're giving more and more, they actually feel like they're being more athletic. It's helpful. What's tricky is that you have someone who's not used to exercise, like they have to be able to tolerate a decent amount of work to get back to certain activities. The thing I find really challenging is I have someone come in and they'll say, you know, they don't really exercise much, but they want to get back to the point where they can, like, I don't know, play basketball or like do like these random activities that are pretty challenging. So I'll just be very open with them and let them know, it's like, if we want to be as safe as we possibly can, we're going to have to treat you like an athlete for these next few months, and you have to be diligent with these exercises over the course of time. The other thing I think is really helpful for athletes is trying to figure out what they'd like to do and what they want to get back to, and making plans and goals that revolve around what works well for their lifestyle and activities and things they enjoy. Because, I don't know, for people who don't like to exercise, it's really hard. It's like trying to learn how to, you know, floss regularly. I think that's acceptable. It's just hard to exercise in general. I
think the mental side of this too is this person is going to come in, and I've seen this a bunch, and say, I'm not an athlete, so you don't have to treat me like one. And because they're surrounded by high school and college kids that I'm treating for ACLs or any other sport, and maybe it's not even ACL, and they psychologically, they're like, I'm not athletic, you don't have to push me, blah, blah, blah. And you need to figure out a way to convey your message that they still have to get back to an athletic type movement called walking and up and down steps, things of that nature, which doesn't feel athletic, but it kind of is when you tear your ACL and your quad becomes mushy. So I still think there's the conversation of building that person up and letting them feel as if they are making gains that are going to be different than the college athlete or the professional athlete. So there's that psychological game you need to play with the person too, and not let them feel too overwhelmed by the process.
Anybody else?
Lenny nailed it.
I think that was pretty good.
Yeah, solid, right? Good. What else? We get another question. Let me hear it.
Aaron from Olympia, Washington. I'm a PT student just finishing up my final rotations. My issue is that I seem to be constantly injured in my own pursuit of staying active. I have a harder time rehabbing my own injuries than I do managing my patients' injuries. Any insight on being your own worst patient?
Dude, props for admitting that. Yeah. I like that.
I like the way they said being your own worst patient. That's pretty good. So Dan, you seem to injure yourself a lot. Dan, what do you think here? I mean, obviously I thought of you with this one because I know, you like to push the limits, right? You're getting old. No, I'm just kidding. I don't know. What do you think?
Well, I think that does happen. You know, you start kind of accumulating these injuries over the course of time, and I call them like little threats, right? Because they're not bad. They're little tweaks, little things that kind of nag from time to time, but they tend to become an issue that pops up in the future if you're not careful about the way you modify your training, right?
Right.
So I think a big thing that I've learned over the course of time is that you can't just go in there and expect to do whatever program that's out there on the market. What works really well for one person is going to not work so well for another from a standpoint of performance, but also from injury, getting hurt again in the future. So I always bring up my hip as I think a good example. It's one of my kind of longest standing injuries. It's something that's kind of been off and on for years now. It doesn't hurt, it's pretty good, but I just have to be careful with what I do from a training perspective. So I come from a background of a lot of squatting, right? A lot of sports I've done, people squat a lot. And it's one of those things where some of the people that I'm training with are going to be squatting 2, 3, 4 times a week, where I squat maybe 1 or 2 times a week. And I have to be careful for how long I squat for 1 or 2 times a week. Like I might be able to get away with a couple months worth of two times a week worth of squatting, but after a period of time, my hip's going to start getting aggravated. I have to back down to once a week. I'm not as great with back squats as I am with front squats. I tend to feel a bit better. You guys know I have some chronic Achilles issues. So I'm always doing funky stuff out here. So a big part of my own training is preventing some of these old injuries from popping up again. What I will say is that that's going to take a lot of smarts, obviously, to learn how to deal with it. Sounds like you have the smarts, I guess, whoever's asking this question. But then, like, the actual enactment, right? I have to do like calf raises twice a week. I don't like calf raises. It's not that much fun, and I do a whole lot of stupid stuff in my warm up just to prepare myself to be okay in the future. I think a big part of that is saying like, okay, you need to do extra work to make sure that you can feel good doing things you like to do, and things you like to do, you might have to back off a little bit. That being said, I think it's really smart to get someone to write programming for you. A lot of people come to me and come to like a combination of myself and Keith from people out here because they're coaches, because they're PTs, and they're smart, but they're missing something and they're not writing the smartest programming. So it's great to have an outsider come and look at all these things and actually design a program that's built for you. It's just hard to write one for yourself.
Yeah. I would just recommend when you transition to more of like your working life to just reevaluate your goals a little bit with fitness and like what you want to get out of it. So Dan and myself, and I'm sure many people who are graduating when they're in college, like they're probably doing some sort of athletic stuff, or they just want to be high level fitness. And for me, example, I was like training 4 hours a day. It was like my life. That was #1 priority. But then as soon as I graduated and got a career, it was no longer the main goal of mine. So I had to kind of like reevaluate, like, okay, I might only get an hour in the gym, or I'm doing a lot more general fitness now because it's not specific to any one goal. So I think maybe taking a peek at what you want to do. If health is just a priority, it's a different program and outlook than if it's like your main thing. If you want to be super competitive and still compete in something, that's awesome. But just realize there's a trade-off there between work, career, health, and specific training.
Love it. Nice. Good stuff. Good episode. Another great question. For those that want to continue on, Kindred, what do we have for information? Come tell the crowd.
Couldn't find it.
What?
I got it right here. So
No results.
Come here.
first Google search.
Come say hi.
Alice wants more from her life than her small New Hampshire town can offer. This 18-year-old's plan is to drive to Florida to start anew. She wants to be a marine biologist, and Florida has dolphins. Alice hits a detour in her journey when she meets a friendly middle-aged couple, must be living at the Skadoodle compound in New Jersey. When Alice's car breaks down, they take her in, and she lives with Mike Skadudo.
Wait. What was your role?
I ate dinner. I ate fake dinner. There was no food on the plates, but I pretended to eat at my dining room table in some scene. I've never watched the movie.
The problem is, the last sentence is, but before long, she discovers the dark motive behind their kindness.
Yeah.
So apparently the Skadudos
You know
were
why?
not so
I
kind
haven't
to her.
seen it because my mom wouldn't let me watch it because I think it's
I'm watching it.
R-rated.
Is this on Netflix?
It's
on
a
YouTube.
drama and a
on
crime. It's a
YouTube.
6.5 out of 10 on IMDb.
That's better than
68% Rotten
the Battle of
Tomatoes.
Winter. Yeah, that's not bad. Wait, so how old were you?
I think I was around 12.
Did you have a 5 o'clock shadow?
I had a beard. They made me shave.
That is pretty impressive. Well, thank you again, everybody. Another great tidbit. Kindred, thanks for being camera shy and not wanting to come on camera. That was awesome. Thank you so much. Head to MikeReinold.com, click on that link to the podcast, and keep asking questions. And be sure to go to iTunes, Spotify, even YouTube. Rate, review, and subscribe, and we'll keep doing these episodes for you. Thanks again.